Good day, I'm Dr. Onya, a practicing general practitioner and Bopi Baptist Hospital dweller, and I'm here at your screen. I would love to talk to you today about the right time for sex, when you are more likely to get pregnant, and I'll ask the question, how can you get pregnant? How can a woman get pregnant? By having sex, of course. Now, it is important to know a woman can only get pregnant during her fertile window in her menstrual cycle. And your chance of getting pregnant is dramatically increased if you have sex of the day of your ovulation or 2 days before that day. Now, it is also important to know the male sperm cells can last in a woman averagely from between 3 to 5 days averagely. Now, the fertile window is the days in a woman's menstrual cycle when pregnancy is possible, and this depends on the length of your menstrual cycle and it varies among women. Now, we see the fertile window is the day the egg is released from a woman's ovary, that is called ovulation, and the 5 days beforehand. That's the fertile period, the day of ovulation and the 5 days beforehand. Now, having sex during this period gives you a better chance of getting pregnant. Okay, now by 12 to 24 hours after ovulation, a woman can no longer get pregnant because the egg is no longer in the fallopian tube. Because actually, when the egg is being produced in the ovary, it moves to the fallopian tube, awaiting the sperms for fertilization. Now, there is almost no chance of getting pregnant if you have sexual intercourse before or after your fertile window. It is important to know if you are not trying to get pregnant. Contraception is your only method. Now, how do you know you are ovulating? Keep track of your menstrual cycle on a chart, a diary, or an app, because there are now phone apps for menstrual cycles now available on Play Store and App Store. Now, on the first day of your menses, that's the first day of your menses is considered as the first day of your menstrual cycle, and the last day before your next menses is considered as the last day of your menstrual cycle. Now, pinpointing the exact day of your ovulation in most women is difficult. It's not an easy task, but it's expected to happen between 10 and 16 days before your next menses. That's the 10th and the 16th days in your menstrual cycle. Averagely, most women have a cycle of a 28 days period. Now, regular cycles that are longer or shorter than these are from 23 to 35 days. We can also consider them as normal, but they are shorter or longer. When women who have 28-day cycles are likely to ovulate around the 14th of their menstrual cycle. So, as I earlier said, a woman is more likely to ovulate between the 10 and 16 of her menstrual cycle. So if you are having a shorter or a longer period, you should be able to predict that your ovulation day is going to fall in between those days. Now, how can you know you are ovulating? There are some signs that you can help you know as a woman that you are actually ovulating or you're getting closer to your ovulation day. Now, a few days before your ovulation, you may notice a vaginal mucus discharge which becomes slicky. That is, your vaginal discharge becomes slicky and slippery. It feels a bit like egg white. Now, those are signs ovulation is going to happen. There's another method that you can use that is called the ovulation kit. You use a ovulation predictor kit. That is, you can buy it from the pharmacy, and you use your urine sample to test whether you are ovulating. Now, a positive result is going to show that you are going to ovulate in the next 24 or 36 hours. That is 1 or 2 days. Now there's another method called the basal temperature method. Now you take the temperature of your body when at rest. The body temperature rises slightly after ovulation. You take your body temperature before getting out from bed, and it is best in the early mornings. Now for you to use this method, I will advise you do this consecutively for 3 cycles. It may not help you pinpoint the exact day of your ovulation, but it's going to make you establish a pattern that is going to give you an idea of when you are ovulating. Now, what is the take-home message? The take-home message of when to have sex and when to get pregnant is you should have sex if you're trying to get pregnant every other day or any day. Now, having sex at least 2 to 3 times a week will guarantee you of getting pregnant. But if you don't find sex enjoyable to be having it for at least 2 to 3 times a week, you can have sex within these days of your fertile window. Thank you. I hope this video helped you to get pregnant. See you next time.